So you will start from the top. From the top. Yeah. Just imagine that nothing happened.
Nothing happened.
What did they do in Men in Black?
Yes.
All right.
Oh my gosh. Yeah, you can. Yeah, we starting. Ready? Yeah.
A very good evening, ladies and gentlemen. It's great to be back. If you don't know this face or the voice, that's fine. I work for a little radio station called Cape Talk. I'm your host this evening. I'm Kino Cummings. And I've got to tell you, we've had lots of discussions around cardio health, etc. I don't favor one particular one, but I do find mental health very, very interesting in the sense that I think it's an overarching challenge which could affect all the other discussions that we've had. So that is the subject of discussion tonight. Mental health. Dr. Hussein, Dr. Ganassan, thank you very much for joining us. I have to obviously tell you that this is brought to you by Life Health and the Brimstone Investment Corporation. But I want to jump straight into it. An introduction to both of you intimately involved in this facility. So Dr. Hussein, let's start with you. A bit about yourself, a bit about your background, what you do here, and an insight into the facility.
Okay, yeah, thanks for inviting me to the show. So a bit of my background. So I trained initially undergrad at UCT, and then I studied, specialized in the UK, did psychiatry in the UK, worked in the NHS for several years, and then came to South Africa. And I work in the private practice. I also do some teaching at UCT as a lecturer. So involved with some medical training. And in terms of what we do here, so I practice as a general psychiatrist, so we predominantly see adult patients, but we see older adults as well, teenagers. And probably as Dr. Ganassan will describe later, most of what we see is generalized anxiety disorders, depression. That's predominantly what we focus on, with some other conditions.
Yeah.
And in terms of why mental health, and I think, as you mentioned, it's an overarching condition. It's an overarching, a very important subject. And I think more importantly is that we're realizing the benefits of mental well-being, yes, but also the importance of the well-being of your mind and how it affects the rest of your body. Yeah? So we often say there's no health without mental health. And that's what makes our field so fascinating.
Well, someone once said to me, you can have R1 million in the bank, 10 million rand in the bank. If your throat is sore, if it's throbbing, if you're not feeling well, if you're feeling empty, that million, 2 million, 10 million rand does not make a difference. Right. Dr. Ganassan, you have an interesting take on the phrase mental health. We'll get there. But first, an introduction to yourself, same as Dr. Hussein, a little bit about yourself and the facility and what you do.
Sure. Thank you, Kino, for having me.
Pleasure.
Yes, I also studied at my undergrad at UCT and postgrad at UCT. Between that, I did some research for a while and found myself in the anxiety and stress disorders unit at MRC and published in that area. And after that, I was consulted in intellectual disability psychiatry, which is another field altogether. Then I came into private practice. Thankfully, I had the time in research because most of what we see in private practice is anxiety and stress disorders.
Mm-hmm.
And eventually I gravitated toward Vincent Plotty and St. Vincent's in our psychiatric facility, because it makes sense to me that we needed to take an integrated approach to the person. And we are fortunate enough to have access to other specialties in our facility.
Yeah.
So it does have this integrated outcome, yeah, because preventative medicine is better than, So going into why I chose psychiatry, this hard, it's serious but half a joke. I was interested in astronomy and space.
Yeah.
So, well, I couldn't do that. I couldn't be an astronaut, but I found the brain, the mind is the final frontier of the human body.
Yeah.
So I found that incorporates a it's multifaceted. It incorporates philosophy, social anthropology, physics, chemistry, and medicine, and keeps me interested.
And that's the thing, right? Never a boring day.
Yeah.
By the way, if you've just come onto the live stream, we are chatting about mental health. Dr. Ganas and Dr. Houston, of course, our guests. I am Kino Kamis, and we are at the lovely Vincent Pallotti Hospital. And this, of course, brought to you by Life Health and the Brimstone Investment Corporation. I want to get, Dr. Ganas, to your take on mental health, or people call mental disorders, whatever. I mean, you've got an interesting take on that.
Yes, it's never sat well with me. Mental health, unfortunately, has a great stigma attached to it, and unfortunately not only in the general population, but also amongst our peers.
Okay.
And that is unnecessary, because it is probably the most important. Yes, something biased, but I'll explain why. And then the word mental, over the decades, just brought with it so much stigma that I felt it didn't really capture what we have evolved into this 21st century and where we are going.
Yes.
I would prefer, hopefully, going forward, we could describe it as the health of the mind. And in my understanding, and it's not the reinvention of the wheel, right? I think it occurs in other first world countries as well. If you get the health of the mind right, address it at the top, all lifestyle diseases can be improved. I'm sure Dr. Hussein will speak more about that. Lifestyle diseases such as diabetes, hypertension, cholesterol, obesity, and then of course addiction, and with that comes trauma, will be addressed. And we'll probably go into a little bit more as to why people do what they do and their behaviors behind what they're doing in COVID. But that's how I see why mental health should be given a little bit more direction and interest. And yeah, rather call it the health of the mind.
Yeah. And there are probably more people who suffer with things like depression, and they don't even know it. Because I was sent to a friend of mine who happens to be a psychiatrist. He said, you know what, some people just become functional, and they try to compartmentalize. But inside there's that emptiness. Inside there's the, I just want to get off the planet for a little bit, get away from everybody, hide in my little corner, and then I'll get up and I'm back to life and I'll pretend everything's okay. And there must be lots of people, you might be feeling that way. And we'll get to what you potentially need to do to try and find some assistance. And I think it's very important, because part of stigmatization, I think, is also people going, oh no, if I tell people that I'm feeling depressed, what's my boss going to say? What's my wife going to say? What's my husband going to say? And that is something that I think prevents people from actually seeking the assistance that they sometimes desperately need. So Dr. Hussain, let's get back to you on COVID-19. There is COVID-19, but there's also the associated lockdown and the effects that it's had on adults and children. Just your take. What are you seeing, and how does it present itself?
Yeah, I think the first thing to start with is to say that what we're going through is unprecedented, and I think that puts some context to when we talk about this topic.
Yeah.
And from what I've seen, there's been an evolution. So I think initially when we had the first lockdown, the fear, COVID, there was a lot of anxiety. But also it was something new. I mean, this whole concept of lockdown was something new to many people. So initially it was a bit of euphoria, long holiday, I'm going to be at home. So I think the initial first few weeks, it didn't really dawn on people just how difficult it's going to be.
Yes.
And as lockdown progressed, then we started to notice and see the change in people's mental attitude. Anxiety started becoming more common, depression started becoming more common. And in fact, I even describe this to my patients and say, in prison, they used isolation. So you put in solitary confinement as a form of punishment. And now we're actually enforcing that in the population by preventing people going out, preventing people socializing. And as human beings, we are social creatures. So to prevent somebody from just doing what is natural to the human being, which is go out socializing, that in itself is usually emotionally distressing. So at a population level, we are forcing people to do something that's unnatural, and therefore we see the consequences at a population level. And we've seen across the world rates of depression and anxiety doubling and tripling in countries where there's been a lockdown. And clearly even in our country, we've noticed huge spikes in anxiety and depression. And then with the lockdown, there's been other repercussions as well. So, loss of job, loss of structure and organization. One of the things that I've picked up, particularly in my clinical practice, with the prolonged lockdown and people working at home, for some people it might have been great, but for many other people, they found that they lost their normal structure. So, for example, somebody would have to get up at a certain time, get ready, go to work, come back at a certain time. That automatically structures your time in your day and your activities. Now you lock down at home. There's no boundary between what is work life and what is personal life.
Correct.
And then if you add to that, you've got the kids at home, you've got the spouse at home. So you don't have that personal space. There's an invasion of work, personal life, kids, spouse into your life. So many aspects of the normal functioning and structure have been disintegrated, and that's been usually distressing for many people. Also, coupled with that, if you think about how kids have had to adapt, for them, like I said, initially it was a bit of a euphoria holiday period, but but again, as the years progressed, kids have found it really difficult. So there's the fear factor, will I get ill? Will my parents become ill? There's the lack of socialization with their friends, and again, most of them would have been at home doing online schooling as opposed to going in until sort of maybe recently they were going in. But initially, that social aspect, they were deprived of the structure around education, they were deprived of. There was a lot of uncertainty, and particularly if I think about matric here, my daughter's matric, a lot of anxiety around matric exams, what's going to happen, uncertainty which wasn't there for previous years. So it's been incredibly difficult and stressful, I think, for many students, but particularly for the matric students. So at various levels, we've had lots of difficulty. And when we look at the elderly, I think they're particularly badly affected because we're very concerned about their health. So therefore, we tell them, please isolate. But also, when you're isolated as an elderly person, it becomes very difficult. Your movements are even more restricted. You're not even allowed to go to the shop. So you are literally in solitary confinement. And psychologically, that's been very difficult. And we found many elderly people complaining of being lonely, complaining of anxiety, depression as a consequence, and also their own fear of, will I get COVID? Because they also know and they're aware of the risk that if I get COVID, the potential repercussions, and they've probably also seen, perhaps their friends and their colleagues becoming sick, ending up in ICU. And we have to also be realistic, there's the real threat of death. So many families have been touched by relatives ending up in ICU, people dying. And again, this brings another dimension. So when we think about under normal circumstances, somebody passes away, somebody's sick, there's the family or friends would rally around, visit the person in hospital, you'd be able to have a funeral, memorial. We couldn't have any of those things during COVID. So even the whole grieving process had been interrupted. And that, again, is very distressing. So a relative passes away, you can't be with that relative in ICU or in hospital. Person passes away, you can't have a big funeral, you can't get the social support that you would normally have. So the social customs and norms that we were used to, all of that has been disrupted. So at various levels, we've seen lots of distress, and now we're also seeing the financial repercussions. So many people having lost their jobs or having reduced income, which again is usually distressing. So from a financial point of view, it's stressful, and that filters then down into social stresses in terms of the family and then also the broader society. So we're seeing many aspects of our lives being affected just, by one change, COVID, but it has this domino effect. And even now, we continue to feel the effects. And the concern now is obviously the second wave. So we're starting to see a rise in numbers. And with the rise in numbers, we're going to have potentially a rise in anxiety levels, depression, possibly maybe another lockdown with those repercussions as well.
By the way, if you just tuned in, it was Dr. Hussain, by the way, and we are at Life Vincent Pallotti. Dr. Ganassan, I'd like to get your take on that as well. But you said two things there. So young people, children, let's call them children. They're social beings generally. They need to feed off other children around them. If you are a single child at home, probably affects you more. If you're used to having your friends, Even if you have your siblings, it just depends on the type of sibling you have. But generally, it has brought a lot of stress to parents. We'll talk about the tips, and it's also recognition for me is a big thing. How do you recognize that you actually have something that needs to be addressed, right? So we'll get there. The other thing you mentioned was older people, and I do know that you specialize in, you've got a geriatric specialty right here at Life Vincent Pallotti as well, which I'd like us to potentially go into a bit later. But Dr. Ganassan, from your side, I mean, we're chatting COVID, we're talking about the impact. What have you seen?
Yes, human beings, we are creatures of habit, it's called habit, and we like predictability. When we don't have our rituals and our routines, it brings upon immense anxiety. And sustained anxiety and worry will eventually lead to mood disorders, not only amongst people who never had them before, but relapses in people who do have them already. And that's what we've been seeing in our practice. Some just general stats that we all know, Dr. Hussein has mentioned. Globally, the sales of antidepressants have increased, anxiolytics have increased. Our South African Depression and Anxiety Group phone calls have increased, I think the number is about 63%. Most of the articles that have been published in the South African population in this year will be in the region of a 50% increase in any given stress or worry. Yes, and there's another aspect. From working at home, or being under house arrest, you lose the ability to transition from home to work.
Yes.
And then in your drive, listen to your radio, screaming at road rage, whatever. It's a transition. And then back again. A lot of people, the bed is there, and the desk is there. That's not going to work. And your kids are outside your room.
Yes.
Now, that's a good recipe for cabin fever, irritability, distress, and depression, anxiety, and so on.
And let's not forget Zoom and what's it called, Teams, and all of a sudden everybody thinks, and I don't know if you experience this at home, if you're working from home, but everybody thinks you are open to a meeting. And I think this is something that maybe bosses and managers should bear in mind, because this is all part of mental well-being.
Yep.
You need to give people the space, surely, to have a break. I now start asking my bosses, could that not have been an email? Why do we have to always meet about everything? Because it just compounds this particular pressure. But I'll ask about tips. I mean, that's important, right? But before we talk about tips, we first need to realize that there's a challenge. And that is something I'd like us to get into. So recognition. Like you need to recognize when you might have issues with the heart, etc. You do exactly the same with one of the most important organs in the body, the brain and the mind. So in terms of recognition, what is it that people, family members, should look out for when it comes to their loved ones, and what should I look out for to be able to recognize it within myself?
Yeah, and I think firstly, I think you're absolutely right. Recognition is very important. So I think firstly, being aware of your stress levels in terms of your workload. So realizing that if I'm working a lot more, I'm going to at some point burn out. So just recognizing in terms of the load that you have, be it the family load, the psychological load, work pressure. Number two, in terms of recognizing yourself, is having a barometer, like an internal barometer. Okay, this is kind of my normal level. This is where I normally am, and looking for changes from that. So for example, we would look at changes in sleeping patterns. Are you sleeping more? Are you sleeping less? Are you eating more? Are you eating less? Another key one is your mood, your irritability. Are you becoming snappy? Little things that would irritate you, things that normally wouldn't affect you, start now to grate on you. So you're becoming less tolerant. Are you finding that you're not enjoying life as much as you used to? So things that you would perhaps normally enjoy, your leisure activities, things that would give you pleasure, enjoyment in life, you find that can't be bothered, not motivated. Also from a sort of cognitive mental point of view, you find that you're a bit slower, you're perhaps making more mistakes, you're less productive, staring at your screen for hours. So I have a few patients describing this to me where they would literally sit in front of the screen and 3 or 4 hours pass by and they haven't touched the keyboard and they don't know that 3 or 4 hours passed by. So they're sort of zoning out and not realizing that. So those kinds of little changes within yourself are important. And then externally, what somebody might see in others would be a change in their behavior. So again, we talked about the irritability, they becoming more withdrawn, not enjoying life, not sort of participating in social activities like they would do. And you might even see things like changes in appetite, they're losing weight, or conversely, they're eating a lot more, so stress eating. So not eating because they're hungry, but eating because they're stressed. And what I've noticed a lot of is weight gain during COVID. Because
I'll put on a couple.
yeah, and a combination of factors. So one is, you know, the fridge is just there, so you have easy access.
It's just away from, it's not too far away from your workspace.
Exactly, not too far. And then also lack of exercise, because partly it's been enforced that you can't leave the house.
Yeah.
But also because of the change in the normal routine, which I described earlier, people are not exercising as much as they used to. And in fact, exercise is actually good for your physical and mental health, but people are being deprived of that. So you see a number of changes. And I think probably the one or two most important things that I would highlight is that where people are starting to become so disillusioned, so despondent that they're starting to feel hopeless, they're starting to feel helpless, where people are starting to feel that life is not worth living, just, you know, feeling that they want to commit suicide or that they're thinking of death a lot more. I think these are what we call the red flags. These are really important things. So if you're recognizing this within yourself, this should alert you that you really need to get help and then, you know, contact someone for assistance.
The challenge with that, though, is you sometimes have family members telling you, oh, you're just looking for attention. You're not really going to do it. And there have been countless families out there, very sadly, who realized that they should have listened to it.
Yep.
But I think it's about empowering the people in the house as well.
Yeah.
Dr. Ganassi, your side.
Oh, just add a little more on what you're saying, because I agree those are markers of when things start going awry.
Yeah.
We can't forget substance abuse.
Yes.
Because that's something that is just so prevalent around the world, and especially in South Africa. Whether we ban cigarettes or we ban alcohol, it's still around. And gender-based violence has increased around the world. So those are two other areas that need to be considered. Yes, sir.
Now, I want to talk about the tips, right? And I think it's important to do so. And maybe we should start with tips for oneself. Because, you know, at the end of the day, you need your own toolkit, right? If you're only going to rely on people around you, good luck. It depends who's around you. What are some of the I don't want to use the phrase self-help, but what is it that I can do?
Yeah.
What can I change when it comes to the environment around me to look after myself as well? Self-love, I would imagine, is very important in all of this.
Yeah, so I agree. And I think the first part is about boundaries. It's what I touched on earlier, where, you know, because of the lockdown, the normal boundaries, normal sort of divisions in your life that would have existed are now all merged into one. So it's reimposing those boundaries and say, for example, if I'm working from home, you know, my workday would start at 9 and close at 4, and I've got to be very strict about that. So after 4, close the laptop. You know, if I get an email, if I get a phone call, sorry, you know, I'm offline now because it is now my personal time or my family time. So that's one example of having very strict boundaries. And similarly, in fact, one of the things I've actually read is that, ironically, during lockdown, people have actually been working longer hours, not fewer hours. And certainly many of my patients have been describing, you know, working till 11 or 12 o'clock at night instead of finishing at 4 or 5 o'clock, which is what they would normally do. So just coming back to this, the boundaries are important. And similarly, boundaries around other activities. So making sure that you slot in personal time. So, you know, you have 24 hours, but you need some me time. So me time might be going out to exercise, maybe watching some TV, doing some other leisure activities, but that's also important. It's not wasting time, it's actually looking after your well-being, particularly mental well-being. Some family time is important. Making sure that you're eating well, making sure that you exercise, because these are important aspects to maintaining your well-being. So the important part is about balance. So within 24 hours, you need some balance. So you need a little bit of everything. And when I speak to my patients, I usually talk about 4 boxes. I say there's 4 boxes, and you need to have ticks in each of the 4 boxes. So the first box is about your physical health. So the common sense things: exercise, eat well. If you prescribe medication, make sure you're taking your medication as you should. Also, very importantly, your sleep-wake cycle. So maintain a regular sleep-wake cycle, because one of the things that we've noticed with lockdown is that because you have the luxury of now working at any particular time, we're noticing that the sleep-wake cycle is shifting. So people are starting to stay up later, watching Netflix, watching DSTV till 1, 2, 3 o'clock in the morning. Then they're sleeping much later. So their natural sleep-wake cycle has been shifted, and that's not very good. So it's important to re-establish your sleep-wake cycle and make sure that you maintain that sleep-wake cycle as it would have been had you been going into work. So that's part of your physical well-being. And then looking at your psychological well-being, so this would be things like making sure you have support, making sure that you have family members or friends to talk to. If you feel you need professional support, then access, there's lots of telephone support. So fortunately, with us as mental health professionals, we can offer out telephone consultations, video consultations, be it a psychologist, psychiatrist, so you don't even have to physically come in to our office space to see us. And certainly in lockdown, I was offering a lot of video consultations, so many people were very anxious about coming to the hospital because of fear of COVID. So we have the flexibility of offering that type of service. So you still have the support within your home, and you get to see a professional. So that's looking after your psychological support. And then your social support, it's about really minimizing isolation. So yes, you may be at home, but again, we have IT platforms. You've got your Zoom, you mentioned, Teams, but also things like Facebook and other social platforms where you can, in a positive way, stay in touch with friends, stay in touch with family members. So that social connection is very important to maintain.
Yes.
Yeah? So you may not necessarily see them physically, but you still have that social contact. So socially, that's important to look after. And also socially, it's important not just to look after yourself, but also spend some time looking out for others. And we talked earlier about where the elderly might feel very isolated. So, pick up a phone and say, how's my auntie doing? How's my uncle doing? How's my granny doing? Because they may not necessarily be able to access social media or IT platforms, but, just give them a call now and again.
There's a record number of grannies and grandpas who are now tech savvy.
That is true. That is true.
which is I remember doing years ago an interview with Helen Suzman, and we were talking about how tech savvy you are. And she says, I have to keep in touch with my family. I've been forced to learn how these things work.
Absolutely.
But it adds value, though. They feel connected.
Yes.
Right.
Yeah.
And Dr. Kadasan, what about the friends you have around you, right? Not you physically, but generally. That all impacts your brain. I mean, you've got people who you have different types of friends. You get those who just want to be with you for the merry good old times. You get those who like pulling you down all the time. So it's very important to also surround yourself with the right people, and also to recognize, I would imagine, who you have around you and who feeds you mental poison, if you like, versus giving you hope and balance.
Yes, important aspect. A lot has been written about this, and maybe we can broaden the question to there is a lot of research around being mindful, and we're talking self-care. Self-care. Being mindful of not allowing yourself to be bombarded by the myriad of negative things that COVID brings you. So Facebook can also not be that good.
Twitter as well.
If people are only receiving negative information. You look at CNN, you see lots of the numbers. So mindful information is one thing, but how you get the information and how you filter it and how you balance that is very important. And also the type of information you get. It needs to come from credited sources.
Yes.
Be mindful of how and when you want to receive information. You don't need it all the time. One thing that Dr. Hussain also touched on is how one structures the day. Yes, sometimes people have difficulty maintaining the structure. Boundaries is one of the biggest things.
Yeah.
And so I say to them, let's start small, because small wins matter and will come first. Then you get the big wins. Get up and make your bed. You know, because if you're living in an apartment, okay, you're living in an apartment and you're living in it for weeks, you let things go.
Yes.
And when you look around you and you see a mess externally, internally, you start becoming a bit of a mess. Get up and make your bed. Get up and do a few push-ups. Get to work. Do a little bit every day. The structure will come back. Your mood will come back. Interact with people on that balanced level. Your work productivity will come back. Your mental health, mind health will come back, and your physical health will come back.
But it's not always easy, right? You say
easier said than done. Everything.
But as you say, incrementally. You know, if you go into, it's even like dealing with diet. You go, all of a sudden you've got to eat leaves.
Well,
it is not sustainable to just start doing that right up front. You have to work it in. Because how does the mind work when it comes to that? What can you tell us about that? So when it comes to building, forming habits that are good, what is it that we need to know about the mind and how it works, and generally how you effectively can get those sort of things?
Okay, so let's call it a default mode of functioning, a pattern of thoughts, a habit.
Yeah.
There's a biological reason why we have habits. I don't need to go into that, but it's there.
Yeah.
And so how do you reverse that? As we say, incrementally, we focus on small wins. We focus on glass half full. We focus on gratitude. What do we have here, as opposed what don't we have? Be appreciative of what we have. Life is short. Enjoy it while you have it. And then from there, it slowly adjusts.
Right.
We've known this for years. Addiction, for example, that's the sentence we've known that doesn't happen overnight. You don't stop an addiction overnight. But there are certain things you do slowly, step by step, and you will get to where you need to get.
Now, there's the realization. You've given some wonderful advice and tips. I like the idea of making up the bed. I think my wife would like that one too. But how do I seek help? How do I... So let's talk about my interaction with Life Health, with Vincent Pilot in particular. I now realize I have a challenge, right? I want to take my life back. I want to be who I used to be, or I find out that one of my family members has a challenge and I need to seek help. How does that work? Where do I start? What do I do? It's such a big thing, you know, having to deal with that in your household. So what are the key steps following that?
All right. First, I must say you came to the right place.
Oh, thank you. I'm getting the discount.
Okay, yeah. No, it's a very important question, because often people do feel very overwhelmed, and or families sometimes feel very overwhelmed and not sure where to get help. And sometimes the broader mental health system can be quite complicated to navigate. So I think I would start and say, you know, we've got a range of services that we offer, starting from our emergency departments. We have an emergency 24-hour-a-day emergency service, which is a general casualty emergency service. But within that, we also deal with psychiatric emergencies. So, for example, somebody might be feeling suicidal. Somebody might have self-harmed. Somebody might be, for example, confused or presenting with very odd behavior. They can come to our casualty officers or medical doctors. They'll be able to deal with that. If there's a mental health component, we also have psychiatrists who are on call 24 hours a day. So we have access to a mental health team. And then from there, if you then need to be transferred or you require more skilled intervention, for example, mental health admission, we've got a dedicated psychiatric unit right on the premises. So we can literally send you from the casualty into our unit. And at the unit, we have a multidisciplinary team. So we have psychiatrists, we have psychologists, we have occupational therapists, and we have a range of other services around that. We have professional nursing staffs, dedicated psychiatric nursing staff. And as I think we mentioned earlier, we're not only specializing in adult patients, but we also have an old age service.
Yes.
And we have specialist psychiatrists who deal with old age psychiatry. We have a geriatric service, which is very nice because many other units don't really offer that service. And that's quite a specialized service. For example, they would deal with things like dementia. So they would also see patients who, for example, might have cognitive problems. And not just cognitive problems, but also elderly patients who might be presenting with anxiety, maybe presenting with depression or other psychiatric problems. One of the advantages we have in our facility, I think compared to many others, is that because we on the same campus as the general hospital, we have access to all the other specialists, so we can co-manage patients. And very often we talk about comorbidity, meaning that somebody might have a mental health component and they will have a physical health component, and often the two go together, so they might be physically unwell and mentally unwell at the same time. And there are very few units that can co-manage, and we're one of the few units that can co-manage somebody who has both. So, while you're either on our unit, you can see a physician. Conversely, you might be on a medical unit, and we would go out and see you on the medical unit and provide the mental health intervention there. So what you're really having is a holistic, comprehensive assessment and care, not just from a mental health component, but mental and physical health. And beyond that, we then offer aftercare. So some of our OTs offer aftercare groups. And then also we as psychiatrists and psychologists would continue seeing patients in an outpatient clinic or outpatient services. And those that might not necessarily need inpatient admission but might need to be seen and maybe not as unwell, then we would offer an outpatient service. So you have a range of services from very important dedicated emergency services to maybe less complicated outpatient services.
Right. But then you're not only dealing with the patient, I would imagine everything else that impacts on the patient is also dealt with. So the family members, how do you deal with someone who has spent time with a psychiatrist? How do you deal with, as a family member, do you empower people to do that?
Yeah, absolutely. And dealing with family is very important. So as part of the process, we provide psychoeducation. So we have, as part of our inpatient program, we have a skills program run by occupational therapists, psychologists, and I also do some talks on that. And particularly, the two talks that I do are focused to help family members as well, to raise awareness around depression, around anxiety, describe to family members what's really happening when your loved one has depression, anxiety. And similarly, the other psychiatrists, psychologists will also provide family interventions. So educating family members, but also providing specific psychological interventions where that's required for families, and couple therapies as well.
Okay, so you've tuned in. Thank you very much. I'm Kino Cummings. This talk on mental health brought to you by the Brimstone Investment Corporation, Life Health. We have the lovely Life Health, of course, Vincent Pallotti Hospital. Dr. Ganassan, Dr. Hussain with us today, both psychiatrists. What about matriculants? I mean, this is a they call this a black swan event. I call it a white rhino event. It is that, it has that much of an impact on us as a society. And when you have children, and particularly teenagers. Now, if you are a parent of a teenager, before March, it wasn't easy. But post-March, lockdown, it's become infinitely more difficult. So, two things here, Dr. Ganassan, it's from your side. There's the impact on matriculants, school, pressure to get the A's to still pass despite all of this. And then there's the other general lifestyle issues that have also been impacted as a result of lockdown. How do we deal with that?
Okay. In the most creative way possible, with no one has the best answer.
Yeah.
2 years ago, I was asked to write something about why is there an increase in suicide rates amongst matriculants for a certain use. One of the main things I pointed out was, well, the conditions, the problems don't start in grade 12.
Yeah.
We should start educating our children about the health of the mind from a younger age.
Right.
Because when you are in a state of depression, which is the most common thing that would cause you to commit suicide, you see no other option So you need to be groomed in the very important developmental years to be mindful and express your emotions and have access to school psychologists or social workers. I mean, to be educated. So that was pre-COVID, and in COVID, and in teenagers and their hormones and what they have to go through, the pressures of the current society. And now their loss of structure. I guess as parents, parenting itself is difficult. I think we all parent. Parenting itself is very difficult. But there are a few things that we know, at least we start off with what not to do. Yeah. We should not be dismissive of our children's feelings and emotions because times have changed. Mm-hmm. Maybe the last generation, maybe our parents parented us differently. Now we have to have a conversation with our children. We have to encourage them to express how they feel, but that's important. Yes. When you encourage them to express how they feel, they are letting it out. You are bonding. You are grooming them. You're molding them. Yeah. So I think that is one way. I don't have the full answer. But that is one way of improving and preventing a mental illness as soon as that can happen. And guiding them, because this is unprecedented. We don't know what's to come. And they have fears about the university. I don't know if you want to add.
Yeah, well, I mean, I have a child in matric, so I can tell personal experience right now. So it's great.
Remarkably relaxed. Anyway, yeah.
Yeah, so I think, a couple of things just to add. One is it's not only stressful for the child, I think it's stressful for the whole family. So I think that's important to recognize, that the whole family kind of goes through this matric. I think the parents are probably just as anxious as the children are. Yeah. I think there's one other aspect that I'm probably going to add to what Dr. Gannison said, is that with this sort of last few years, and if we look at teenagers, who've grown through the last few years, there's a huge impact of social media, and that's unprecedented. Certainly when I grew up, and when you guys grew up, we didn't have that level of scrutiny, we didn't have that level of input. You literally have the whole world on your phone in front of you. Yeah. And unfortunately, with that also comes a lot of problems, and particularly about feeling judged. And we know teenagers in general are usually fairly sensitive about their body image, about their self-image. Now, unfortunately, you have how many likes or how many dislikes I have. And that is actually usually stressful. It sounds fairly trivial to us, but we have to also recognize, as Dr. Gannon said, we are dealing with a very different cohort who have been socialized and grown up in a very different world to the world that we grew up in. Correct. And there are certain things and certain pressures that they're exposed to that we just have no idea, and particularly around the social pressures. So it's not just the academic pressures in terms of academic performance and will I get into university, it's also about all the social pressures that go around with it. And very often when we see things like suicide, it's not just about academic stress, it's often about bullying, online bullying, social bullying, or cyberbullying, being isolated by friends. And a lot of that is done through social media. Yeah. So it's also important for us to recognize, what kind of social media your kids are doing, who are they interacting with, and importantly, picking up changes in their behavior.
But at the same time, that's a difficult one, right? So they've got very close friends. Now, you might have your own internal ideas and perceptions of what certain people are like, but you should maybe take the time to find out more about the people that they're mixing with and who they're spending their time with, because our perceptions aren't necessarily reality. Yeah. And we can further alienate our kids if we actually don't spend the time, do a little bit of research, a discovery, as they say. And Dr. Ganassan, you were saying earlier about, listening. And by the way, this is my ADD kicking in, right? But TikTok was a clock when we grew up. Not at the moment, but just getting back to the point I was going to make with you, Dr. Ganassan. I spoke to, we all know Rajesh, right, from TV. Jack Devlin. And I'm fortunate enough to be a friend of his, and we were talking about kids. And they don't like being called kids, young adults. And he said to me, I've got two very difficult kids. I've got, not difficult, they're teenagers. But what I had to do was put away my preconceived ideas and spend time with them to listen to them, to put myself in their shoes, and only then did I manage to calm down a little bit and see things from their perspective.
Yes. Yes. I have a 13-year-old daughter who's going on 13. So, it doesn't come naturally to me, I admit, to parent her. But what she's asking for is to be heard, is that her feelings matter. And we have to train ourselves to sit and absorb that. That's all they want. We may not have to respond necessarily. Sometimes we don't know what the response is going to be. It may be different for different child. And again, I'll say maybe remember what not to do. But sit down, hear the problems. That's all they want you to do. I had to research what TikTok was actually anyway. Now I know. But yes, our children want to know that their feelings matter and that we are not parenting them from how we were parented. But this is because it's changed so quickly, as the said. And how we navigate this bombardment of media is tricky, but there are certain principles that we can pull in that we can discuss.
So, thanks for the questions, by the way. You sent those through. I want to go back to a point that was made earlier in the questions, the anxiety related to results. We as parents sometimes want our kids to become something we couldn't, and we live our lives through them. Or we say to them, despite the fact that we've had COVID-19 and things have been stressful, we're telling them, no, but you have to have the 90%. If you don't have the 90%, you can't be a kid of mine. Fortunately, I'm one of those parents. I said to my son, listen, dude, if you're going to make mistakes in life, do it when you're 18, 19, 20. Learn from them. Don't make mistakes that will kill you. But try things, right? If you don't want to go to university up front, you don't have to. You can always do it next year, the year after. No one's going to ask you when you started studying. So how does one deal with that? The anxiety of needing to prove to everybody that I am now an A student, when I've had probably the most horrid year, as we've discussed earlier.
Yeah.
Anyone of you can go.
Yeah, look, I think it's also about perception. Okay, so if your perception as an individual is built around what other people think, that I have to perceive, that I have to get to the A, so it means my self-image, my self-worth is based really on what other people think. So I go back to the core, it's like, well, let's look at what makes you an individual. Right? What's your value? What are you worth? Yeah, what are your personal qualities? Your personal qualities is not getting an A. Yeah, you are respected as an individual in your own right. You may have certain talents and certain abilities that may not reflect in an A aggregate, but may reflect in other qualities that may be far more important than an A aggregate.
Yeah.
So I think it's recognizing and respecting that individual and helping them to see what's good about them and what's positive about them at that very fundamental level. Right. There may be some individuals that excel at sport. They may not get an A in matric, but they may be very good at track or field. Right? And it's recognizing that, well, actually good at that. Or somebody may be very good at the arts and say, well, that's where you excel. And yes, there are going to be some people who are going to get the A's in matric because academically, that's where they're strong. But they may not be strong maybe in some other aspects. Right. So we also recognize that as individuals, we have strengths and we have weaknesses. Right? And then I think, as I mentioned earlier, it's also about the social pressure. So it may not be that the parents may be putting pressure on the individual to perform, but it might be their peer group, because maybe they're a bunch of clever clogs, and all their friends are getting A's, and if they don't get an A, they feel left out. So that pressure might be built around their peer group. It might be around the school, because the school says, we want 100% pass rate, and that pressure gets filtered down, and because the school or the teachers feel that this is prestigious, we need that prestige as a school, right? That pressure then gets put on the kids, rather than saying, actually, it's okay, if you don't necessarily get the A or you don't pass, it's fine. There are other options. And the reality is that there are other options. Even if you don't get the A or you don't perform well in your exam this year, you have many other options. You can repeat it. There's other options available. Some people may be much better, as I said, physically. Some people might be better with practical skills. So it's recognized that, well, we are diverse as individuals. You know, not everybody can be this. Not everybody can be a top performer in terms of football, on the track. So we recognize that, but so too academically. Yeah? But that doesn't mean you don't have self-worth. That doesn't mean you're not valued.
Very valuable indeed. And get them to find themselves. We are emotional beings before we are logical beings, aren't we?
Absolutely.
I remember reading a book by Professor Kerry Spackman. It's called The Winner's Bible. And, you know, he talks about the fact that when we're born, this prefrontal cortex, which, you know, that we help us make sense of life and rationalize, etc., that still develops at a younger age. And our younger children, teenagers, are still very much what they call limbic. I mean, I didn't study your type of things when I read. But we need to, if we're going to appeal to them, we need to appeal to the emotional side of our youth as well, I think.
Yes. To add to what Dr. Hussain said on that point, yes, one of the most important things is to, again, from communication and in this developmental years, cognitive developmental years, we want to help our children understand that their self-esteem, their confidence is not linked to what someone externally says to you.
Yes.
Look, we live in a capitalistic society, but we also live in a global village. So our options are bigger. Sometimes it's easier to sit on one side and say, well, you know, let the child do what they want to do. But it may not be as easy in every household. So the answers may be different in different households, but I think the fundamental point should be that the child doesn't link their self-esteem and confidence to someone else's perceptions.
Final question. With the stress of exams, etc., is it advisable or okay for teens or youngsters to take calming or herbal meds to help them cope?
Sure.
A broad question.
That's a
suitcase question. But maybe we should talk about the medication around the ones that we know work necessarily, and when you should be taking medication if there's anxiety, if there's stress.
Yeah. Look, I think probably the very short answer is I'd be hesitant to just say take medication without actually having a proper assessment.
Yes.
So my short answer is that if you're feeling that you at the point where you need to take something to calm down, that should also alert you that that's the point where maybe you need professional help, or at least an assessment from a professional to say, yes, perhaps you do need some medication, or no, perhaps there's other alternatives.
Indeed.
I would advise that they first optimize healthy self-care, non-medication first, and see how that goes.
I like that, and I just want to thank all of you for tuning in, for listening to us. This for me is it's a pet subject. I think it's a very important subject, and I want to go back right to the beginning when the doctors were saying that it's your mental health that potentially determines everything else that could cascade down positively or negatively to the rest of your body. And if you're feeling empty, if you're feeling lonely, if you feel like you want to climb off this planet, seek help. If you have a look on the screen, there'll be a number that you'll be able to dial. Utilize that. Hand it over to your family members. But if I can just leave you with one thing, find the help. It will make a difference. I want to thank you very much for tuning in this evening. On behalf of, and doctors, thank you very much for your time. Dr. Ganassan, Dr. Hussain, and thank you very much to Life Health and the Brimstone Investment Corporation for allowing us to have these conversations. Spoil yourself. That's all I can say. Have a good evening.